Did you know that going to the doctor is the third leading cause of death in the United States? I mean, that's like right under heart disease and cancer is going to the doctor. And that's a fact. So let me just start by saying thank you for tuning in. My name is Deidre Renee, also known as the Wellness Goddess, your self-care specialist, and I am passionate about teaching self-care so that you don't have to depend on healthcare. Now, just wanted to put out there that this is no shade to the healthcare community. If you're in an accident, if you're shot, stabbed, you have an acute incident, right, illness, then yes, thank God for modern medicine and the healthcare system. But on a regular basis, as far as taking care of yourself, I would say that depending on going to the doctor is a mistake. Okay, because at the end of the day, the healthcare system is, in this country, it's a machine, and making sure that you're well is not a part of the bottom line, unfortunately, and that's a polite way to say it. Okay, and so because I've worked 15 years in the healthcare system, and these last couple of years, especially working in quality improvement, risk management, and infection control, all three of those departments have to do with what could possibly go wrong. Okay, and as a nurse, when you're given an order, you have to check the 5 rights. Well, it used to be the 5 rights. Now it's the 8 rights. I think it's 8 rights. So let's go through those rights because that's going to make it clear. So the doctor gives me an order and says, John Smith needs to get this medication at this time, at this dose. We have to check. Do we have the right patient? So is John Smith standing in front of us, right? Do we have the right medication? Do we have the right route, meaning how it gets into you? Are you going to drink it? Are you going to swallow it? Are you going to get it in a needle into your muscle? And which muscle is important? Or is it going to come IV fluid? You know, how are we going to get this medication in? So right patient, right medication, right route, right dose, right time, right reason, right documentation, and I'm going to remember the 8th one. Okay, so the fact that we have to take a stop and check that we have the right patient, because if this is John Smith, this could be John Smith born 1975, John Smith born 1950, John Smith born 1990. Which John Smith is this? So the minute you walk into a medical facility and you get checked in and either get that armband or they check your medical card, that's the first moment where they could be making an error on who you are. Okay, then you get back there and you talk to the doctor and they check you out, and then he has a chart on his computer, and maybe the person before you's name was John Smith, and so he just assumes it's John Smith with the cardiac problem, with the diabetes problem, and with the, you know, and then he does all this stuff and writes you something for heart disease, diabetes, and needing some sleep, because the John Smith before you, he just had a lot of patients and didn't realize that you were a new John Smith. This is John Smith born 1975, not John Smith born 1950. And he writes all this stuff. He sends you to the pharmacy. You go pick up a medication. Is it you? Is it a John Smith before? Which John Smith is it? These doctors have 20 minutes to see you. 20 minutes to see you, write your medication order, and get you out of there. Like a, what do you call it? An assembly line. Sometimes it's not their fault. Some doctors really care. But how can you care for a patient in 20 minutes and then go to the next one and then go to the next one? How can you really practice your medicine, right? So just know that there are 8 rights. I'm going to remember that 8th one. I might have to put it in the link below by the time this video is finished. But by the time he's finished seeing you, all he had was 20 minutes. And so again, it's not the doctor's fault. It's not the nurse's fault. It's not anyone's fault. It's just the way it is. Whoever created the healthcare system and keeps changing the policy or making it so that doctors can't take their time and nurses can't take their time because they have to see all these patients, you know, whoever's plan that was. The bottom line is that that is what exists in the United States in the healthcare system machine, which is a capitalistic machine as well. So not very many doctors are going to talk to you about, diet as medicine. They might say, oh, you need to change your diet, cut down on sugar. And then they include fruit in cutting down on sugar, which I think is insane. But they do hit on diet, but it's mostly about the bottom line. If you have to cut fruit out of your diet, fruit is like one of the best things for you, right? So if you're considering fruit and vegetables a sugar that should be cut out of your diet, I think that's insane. And yes, I've been told to tell patients that who had high blood sugar, and I'm not going to say whether I did or I didn't. But things like that is what is the normal practice in medicine in the United States. And on top of that, there can be errors. So my objective and my intention and my passion is to teach us how to practice self-care so you don't have to rely on healthcare. Again, in an emergency, please go to the doctor. Please call 911, right? But every day you wake up, practice self-care, okay? And so we're going to dive into all of the 8 pillars. There are 8 pillars of self-care, and I use the actual spelling of self-care as a reminder because it's hard to remember all 8, so I would say it is social self-care, emotional self-care, intellectual self-care, professional self-care, financial self-care, physical self-care, spiritual self-care, and environmental self-care, okay? And as we get into them one at a time, what's going to happen is that the 8 pillars, because it's 8, which is also a symbol for infinity, they actually touch each other, and you can be practicing physical self-care but also practicing emotional self-care and environmental self-care just because you put yourself in the right environment and emotional state to conduct your activities of daily living. Okay, so it's not hard. All you have to do is learn the pillars and be intentional about it every single day, and you will find yourself more focused. You will find yourself getting more sleep. You will find yourself being at peace, and you will find yourself then in a better state of health because I would even say oxidative stress is the silent killer. Right? So taking your body out of fight or flight, taking your body out of a stressful thought, environment, social setting is practicing wellness. It's not hard, okay? So let's practice self-care so that we don't depend on healthcare, because it's the 3rd leading cause of death in this country. Sounds insane, but it's true. Check it out, cdc.gov. Type in the search box, causes of death, and you will see for yourself. All right? So tune in. We're going to get into it. Just wanted to make this first episode because it's been a long time coming, and wanted to explain all of the ways in which you could be injured at the doctor just because you're trying to be well. All right? We could get the name wrong, the date wrong, the route wrong, the documentation wrong, the medication wrong, the wrong route, right? So think about that. The minute you step into a medical facility, you've put yourself at risk of the 3rd leading cause of death in the United States. And why did you go? Is it a regular checkup? Is it this acute condition that you could probably take care of if you practiced some self-care? What is it? Anxiety? I think anxiety is the number one reason why people go to the ER, right? We can take care of this ourselves, you guys. So tune back in, learn about the pillars, figure out how you can implement these things into your lifestyle so that you don't need the 3rd leading cause of death. You don't have to put yourself at risk, okay? So let's practice self-care so that we don't need healthcare.